Oh, which is better, injections or tablets/pills? Is it better for me to take an injection or a pill? Good day, everyone, and welcome back to my channel. I'm your favorite medical professional, Gwendolyn Hale, and I'm popularly known as the medical professional with that difference because I bring you knowledge on health, on medicals, and a lot more. And I do it like no other. If you're just joining this channel, don't forget to subscribe and turn on the notification bell so you stay abreast with all our recent uploads. And of course, you'll be the first to watch. And if you're a returning subscriber, this is me telling you I love you. Thank you so much for expanding the channel, for your making the channel more visible, for your questions, for your love, for your encouragement. Thank you. God bless you. Welcome back. Into this class, I'm going to be teaching you whether injections are better than tablets or pills, and why your doctor decides to prescribe or minister a tablet and not an injection, or why he or she prefers to minister, your doctor prefers to minister an injection and not a tablet or a pill. Before I dive into which is better, injections or tablets, I want to give you some background about injections and tablets, like a brief summary. There are some medications that cannot be ministered to an individual through tablet form. For example, the injections that are given to increase your white blood cell count, it cannot be given in tablet form because most times it will damage the lining of your stomach. And on the other hand, there are some that can only be given in tablet form and not in injection form. For example, if someone has parasites in their stomach or in their intestines, or worms, let's say worms, for example, you need to give the person a tablet or a pill to be able to destroy those parasites or that worm. Now, there are some drugs that come in injection form and tablet form. And most times they have the same dose, 200 milligrams, 200 milligrams. And they are ministered, sometimes the injection is ministered, being diluted by saline before being given. And then you drink this with water orally, the tablet with water orally. So take note of this. If a drug, for example, the antibiotic, ciprofloxacin, is being manufactured in tablet form and injection form, if you take ciprofloxacin 500 milligrams and another patient takes ciprofloxacin injection 500 milligrams, they are both going to be treated. They are all going to be well. They are all going to eradicate the bacteria in their body at the same rate. Just that the absorption rate for the injection is faster than that of the tablet. As long as they are the same dosage, the treatment is at the same rate. So please stop bugging all the health professionals that are around you, thinking that if you take drugs in tablet form, you won't get well. But if you take drugs in injection form, you're going to get well. So when it comes to which is better, an injection is more better than a tablet. It has a better absorption rate than the tablet. In fact, the pharmaco-kinetics and pharmaco-dynamics that occurs when an injection is being ministered is shorter than when a tablet or a pill is taken, because the absorption is much faster. Bear in mind that the tablet also comes with other ingredients, coatings, that keep it in that form, that stabilizes it in the environment, that gives it a shelf life. So it needs time to degrade, it needs time to be absorbed by the body. You know, the body has to react on the drug has to react on the body. So injections have a higher absorption rate. Also, injections are more expensive than tablets. So this is something you should know. And with injections, they don't destroy the lining of the stomach, unlike drugs. Some tablets or pills actually destroy the lining of the stomach. That is why if you're taking a tablet or a pill for a long period of time, most good doctors who know what they are doing, who are good with pharmacology, are going to prescribe to you a drug that will help to prevent that gastric acid from destroying the lining of your stomach. And I'm talking about an anti-gastritis, a drug that will actually prevent you from having gastric ulcers, gastritis, peptic ulcers. So that is very important. Any drug that is taken for a long period of time, over a month, you need those drugs, those anti-gastritis drugs, to be administered so that they reduce the secretion of acid in the stomach. Now, there are different types of injections. There's the intracutaneous, there's the intradermal, there's the intramuscular, there's the intravenous. And they are given at different locations in the body. When an intramuscular injection is ministered in the veins, what happens in that area is an infiltration. The tissues around that area get damaged. What happens when an intravenous or an intradermal or an intracutaneous drug gets ministered in the muscle? You will have infiltration. The tissue around that area will get damaged. This is why when you are going for any form of treatment in a local drugstore, be very careful. And sometimes you find that after they have given you an injection on your butt, let me say for malaria, you find that that area looks dark. That tissue has been damaged. So be very careful. Make sure you know where you're going to. And the absorption rate, when it comes to which is better, the injection or the tablet, and we have come to a conclusion that the injections have a faster absorption rate than tablets. And it also depends on the location where it is administered and the amount of blood flow around that area. So that means that intravenous is faster than intramuscular. Intravenous is faster than intradermal. Intradermal is being ministered at in the fats beneath the skin. That means intravenous, is faster than intracutaneous. So absorption rates amongst injections, or the efficiency of an injection would depend on the location where it's been given and the amount of blood flow around that area. So if you want to look at the 4 types of injections that I have given, the intradermal, the intracutaneous, the intravenous, and the intramuscular, the intravenous is much faster because there's a higher blood flow, level of blood flow around the vein area. So guys, when you go to your doctors, please allow the doctor to prescribe to you the medication that is best for you, or the form of medication that is best for you. There are some patients that, because they are vomiting, they vomit a lot or they are not able to eat, the doctor will then prescribe the drug in an injection form. There are some patients that the doctor, because of the urgency of the case or because of the state of the patient, they will prefer an injection than a tablet. So allow your doctor to do his job, allow your pharmacist to do their job, but also as you move around, make sure that you are knowledgeable. Make sure an intravenous drug is not injected into your muscle and intramuscular, into intradermal, intracutaneous, or intravenous. There will be disaster. There are many people out there who are looking for ways to make money, and they will make money off your ignorance. Please be enlightened and be informed. Be enlightened and be informed, so that when you go somewhere and you are being taken for granted or being exploited, or they're about to manipulate you or carry out a medical malpractice or negligence upon you, you will use this knowledge I am giving you. There's a lot of medical malpractice and medical negligence out in the world. And these are the little things that we are supposed to know. So thank you so much for your questions. Till next time, I remain your seasoned and certified medical professional, Gwendolyn Halle. Bye-bye.